From the studio of South Asia Views.
Since 2014, our country has been plagued by divisive forces. TMC is in Meghalaya with the mission to empower the people, uphold the ethnic cultures and traditions, celebrate the sacred land. To oust the proxy BJP government from Meghalaya, be the change, support TMC by calling on 96877 96877.
Meghalaya Health Minister James Sangma on Monday announced the draft mental policy named Meghalaya Mental Health and Social Care Policy. Announcing this on the occasion of Mental Health Day, Sangma said that it is a holistic policy involving focus on promotion of mental health, working on collaborative work design, emphasize on building safe space and first responder teams, focus to prevent and address stress and loneliness, early identification and care besides other features. He also informed that the draft policy is in the public domain and was prepared by a committee headed by the Principal Secretary Health Sampath Kumar and subcommittee that look into the finer details of it.
As we celebrate the World Mental Health Day today, 10th of October, I take immense pleasure and honor in announcing that the government of Meghalaya, the health department, has completed the exercise of preparing a draft mental health policy, which we are announcing today and which will be put up in the public domain, namely in the website of the Department of Health and Family Welfare and of the Meghalaya NHM. The name of this mental health policy is the Meghalaya Mental Health and Social Care Policy. This policy has been in the making for quite some time. This committee, which was formed to look into drafting this policy, was formed some time back under the chairmanship of our Principal Secretary, who was tasked to come up with the policy. And accordingly, there have been a number of meetings which have taken place towards the drafting of this policy. Another subcommittee was also formed to go into final details of the policy, which was formed some time back, and this subcommittee was headed by Dr. Vandana Gopikumar, who also is one of the members of the National Mental Health Policy Drafting Committee, and also one of the members of the Tamil Nadu State Mental Health Policy. So she, along with other team members of the subcommittee, including Samvad, were been instrumental in providing a lot of work in terms of adolescent and child mental health. We've been able to today, because of the work put in by the subcommittees and by the committee, come up with a mental health policy which is very, very holistic in nature. And I would like to take this opportunity to just go through some of the salient features of this policy that we are.
From the studio of South Asia Views.